I think we're all very worried that what we're going to find is that there is a lot of spread of this new variant in schools, and we're already seeing signs of that. For example, we know that in places where this variant is dominant, the cases in school-age children, particularly secondary schools, have been 3 times as high as other unvaccinated young adults, like 20 to 24-year-olds. And this is a consistent pattern across places where this variant is dominant. And we've then seen spread from these age groups into other age groups in the community, suggesting that schools are actually not just contributing to transmission, but really driving the spread of this new variant across the population.
And in fact, some people have said that some of the higher levels of COVID now in 30 to 40-year-olds, which traditionally, statistically would be the parenting group, that they are much higher.
Absolutely. And we see that sort of double dip pattern where you see high infection rates in children, and then what we consider the parental age group prior to spread into the other age groups. And it's not just about this variant. I mean, each variant that we see, is fitter than the previous one, outcompetes the previous one, and brings us closer to vaccine escape. I mean, I'm very, very glad that this doesn't fully escape vaccines and that 2 doses are still highly effective. But what if another variant comes in that doesn't have that? What happens to pandemic response?
Is that inevitable, do you think, if we keep doing this yo-yo seesaw, open, close, half close, half open? Do you think it's inevitable that we reach this point, even with all the vaccinations, that's it? We have a variant suddenly that's identified that the vaccines are not going to work against, and do they just go back to the lab and come up with a new vaccine like that, or is it much more complicated?
So I don't know about inevitable, but it's highly likely. And I don't think it's just a hypothetical, because we know there are variants that exist now that with very high levels of escape against vaccines. The so-called beta variant, or the so-called South Africa variant is one of those. And there's very good data from University of Cambridge that shows the best conditions for the virus to adapt towards escape is when you allow high transmission with vaccination of the vulnerable predominantly, because then what you have is high levels of transmission among populations that are not as vaccinated. The virus spreads and comes into contact with this wall of immunity or selection pressure, and variants that are more likely to escape become selected. So that combination of transmission and selection pressure creates a fertile ground for that sort of escape. And we're just going to start seeing that now as more and more countries have a high level of vaccination. We haven't had that level of selection pressure in the population yet. So we really haven't seen the entire breadth of the mutational landscape of this virus. And it's very, very likely that we're going to get more escape mutants that are more likely to escape. And the problem is our entire strategy has been based on vaccination. So much resource has been put into vaccination. And yes, people say we can update vaccines, but how are you going to keep up with virus evolution? I mean, we've heard recently that AstraZeneca is in the process of developing a vaccine that works against the so-called South Africa variant that our government in the UK is now ordering. But that's not a dominant variant anymore. In fact, it's been outcompeted completely by the Delta variant. Now we need vaccines that work against the Delta variant. And by the time they come into place and we vaccinate a substantial number of people with them, there will be another variant. And this virus is not mutating to become flu, like some people say. It's mutating at every step to become more transmissible, possibly more fatal. We don't know that about the Delta variant yet, but certainly the Kent variant did, and towards more escape. And unless we exercise our agency to prevent that, we can't expect the virus to stop adapting. And the only way to prevent that is to stop transmission.